Hi, my name is Chloe Madsen, and my presentation will be on cervical cancer. During my presentation, I will be covering what is cervical cancer, the symptoms, stages and development of cervical cancer, treatment, risk factors, protective factors, incidence and prevalence among ethnic and cultural groups. What is cervical cancer? Cervical cancer occurs when abnormal cells on the cervix grow out of control. Cervical cancer is cancer of the cervix, which you can see in the image to the right, which is defined as the opening of the uterus that extends into the vagina. Most precancerous or cancerous cell changes occur in the cervix at the transformation zone, which is located in the cervical canal, because these cells normally undergo constant change. So now we must consider the causes and risk factors of cervical cancer. HPV is a leading factor in cervical cancer. It is the human papillomavirus. There are 38 different strains of HPV. However, 16 and 18 are the most virulent forms that lead to cervical cancer. Having many sexual partners, because that enhances your risk of acquiring HPV, is also very serious. Having herpes simplex virus and chlamydia is also a leading causing factor. Because of the fact that it is an open sore, it is easier for the virus to enter the bloodstream. You can get HPV also through the anal canal because it thrives in warm and moist places. Women with lower genital tracts are more likely to develop cervical cancer. Most importantly, a plethora of women wait way too long to get screened or never actually do get screened at all. Okay, now we're going to talk about symptoms. It is very rare that cell changes will cause any symptoms, but if cell changes progress to cancer, some symptoms may include unusual vaginal discharge and extreme pain during sex. Once cervical cancer does advance, symptoms may include consistent pelvic, back, or leg pain, or urinary problems because of blockage. In the image to the left, you see various images of cervical cancer symptoms. There are multiple stages in the development of cervical cancer. So first, starting with stage 0, the cancer cells are only in the cells on the surface of the cervix, without growing into deeper tissues of the cervix. Then you proceed to stage 1. In this stage, the cancer has grown into the cervix, but it is not growing outside the uterus. Then moving on to stage 2, in this stage the cancer has grown beyond the cervix and uterus, but hasn't spread to the walls of the pelvis or the lower part of the vagina. And in the image to the right, you see the progression of these stages. Now looking at stage 3, the cancer has spread to the lower part of the vagina, or the walls of the pelvis, and it may be blocking the ureters. These are the tubes that carry urine from the kidneys to the bladder. Moving on to stage 4, this is the most advanced stage of cervical cancer. The cancer has spread to nearby organs or other parts of the body. The cancer has spread to the bladder or rectum, which are organs close to the cervix. If the cancer metastasizes, it can spread to nearby lymph nodes, which are lymphoma. So now looking at how physicians treat cervical cancer. If cervical cancer is found in earlier stages, it is more likely to be successfully treated. The type of treatment used is solely based on the type and stage of the cancer. This could consist of one or multiple therapies depending on which you decide to go through. Different treatments consist of one being surgery. This is deciding on whether to follow through with surgery to remove the cancer. It depends on things like the location of the cancer and the extent of it. You also want to consider important factors, including your overall health and how it can affect it, and whether or not you foresee yourself having kids in the future. Radiation therapy is another treatment. This is a technique that is commonly used when the cancer is advancing, and there are usually no better options. It consists of using a high dose of X-rays to kill the cancer. Next, you have chemoradiation. This is usually used in sequence with chemotherapy and radiation. A vast range of individuals use this in early stages and late stages of cervical cancer. Then you have chemotherapy. This simply is the practice of using medicine to kill cancer cells. It is usually used to treat advanced cervical cancer. There are various methods one can take to decrease the risk of developing cervical cancer. The most important preventative method is to have a screening such as a Pap smear. Pap screening tests should be given at the age of 21. Routine screening is recommended every 3 years for women ages 21 through 25. If there is an abnormal screening or you have multiple partners, physicians suggest getting screenings yearly. Another preventative method is to quit smoking. Studies show that women who smoke cigarettes or intake secondhand smoke are more susceptible to having cervical changes that eventually lead to cervical cancer. Also, getting the HPV vaccine is very important. If you are 26 or younger, you are encouraged to get the series of shots consisting of Cervarix, Gardasil, and Gardasil 9 to protect against HPV. It is important to note that these shots do not protect against all 38 strains of HPV. Now looking at incidence and prevalence. Cervical cancer used to be the leading cause of cancer death for women in the United States. But in recent years, the number of individuals that developed cervical cancer and deaths from it have decreased significantly. The estimated number of new cases in 2016 were 12,990, which is approximately 7.5 cases per every 100,000 women. This is equivalent to 0.08% of all new cancer cases. Prevalence of this cancer in 2013 was an estimated 248,920 women living with cervical cancer just in the United States. Now we are going to take a look at incidence and prevalence based on ethnicity. More Black and Hispanic women get HPV-associated cervical cancer than women of other races or ethnicities, possibly because of decreased access to Pap testing or follow-up treatment. In general, HPV is thought to be responsible for about 91% of HPV-associated cervical cancers. Depicted on the graph below gives the approximate amount of women in each ethnicity group out of every 100,000 that develop cervical cancer. For white women, it is roughly 7. For African American individuals, it is around 9. For American Indian and Alaskan Native, it is about 6, as well as for Asian and Pacific Islanders. For non-Hispanic individuals, it is around 7, versus Hispanic individuals being 9 out of every 100,000 women. And here are all the web pages I visited to gather all my information. Thank you so much.